Everyone, welcome back to my channel. I'm Nazira and I'm a student nurse, and today we'll be talking about something very common but often overlooked, and that is constipation. So by the end of this video you will understand what constipation is, its causes, complications, symptoms, and how to manage it both in nursing practice and in daily life. The first thing there is to ask yourself, what is constipation? So constipation is infrequent bowel movement or difficult in passing at stool. Clinically, it is often defined as having fewer than 3 bowel movements per week with hard stool. Like the stool will be very hard. If you are passing out stool, it will be very hard. So what this grammar simply means is that constipation is finding it difficult to defecate. Like if you are defecating, the stool will be very difficult to pass, like very difficult, and it will be very hard. Like it will be like you are giving birth, you'll not be doing that is just constipation. Now the next thing there is to ask yourself, what can actually cause constipation? So constipation actually have a lot of several factors that can cause it, and the first factor there is diet and lifestyle. Your diet and your lifestyle can cause constipation for you. For example, if you're not eating enough fiber, you're not taking enough fiber like vegetables, fruits and legumes, like it will cause constipation for you. Some people just eat in the morning fufu, afternoon rice, gari, everything. They're not taking fiber. Some hardly take fruits. It's very bad. It can cause constipation. And again, how your diet and lifestyle can also cause constipation for you is by not taking enough water. People do eat, after eating they will just take soft drink instead of water. It's very bad. Eat after eating, take soft drink or anyone you know, then take water. Water is very necessary for the body. It's very important for the body. Don't keep your body dehydrated. It's very bad. Lack of physical activity can also be a lifestyle that can cause constipation for you. From morning till night, you just sit down one place, sedentary lifestyle. Your own is just to eat, drink and sit down. You not just walk around, do some exercise. Is very bad, and it can cause constipation. So after eating, after some minutes, you can take maybe 10 minutes walk. It's good for your body. It's good to the health. Okay. So another factor that can cause constipation are medical conditions such as diabetes, neurological disorders like Parkinson's disease. Aging can also cause constipation. Even pregnancy as well can cause constipation. Medication is actually another factor that can cause constipation. Medications such as iron supplements, antidepressants, opioid, or some blood pressure medications can also cause constipation. So another factor that can cause constipation is ignoring the urge to defecate, and this is very common, like very common. And delaying that urge to defecate, it leads to constipation. So once you have the urge, go and poo. Pathophysiology of constipation. Here, this is how constipation develops. When the stool stays too long in the large intestine, the colon will absorb more water from it, making it dry, hard, and difficult to pass out through the anus. And this will likely lead to straining and discomfort when defecating, which can also maybe lead to hemorrhoid. So constipation is So how do you know that maybe you're having constipation? That leads us to the signs and symptoms of constipation. So the first sign there will be hard stool. Like, one, the stool will be very very hard. Like, when I mean hard, very hard. Sign there is fewer than 3 bowel movements per week. Like, in a week maybe you just defecate 2 times or 3 times. That is another sign that you are having constipation. Then another sign is straining during defecating. Like, you may actually have a tear in the anus, which will lead to small drop of blood in the anus. That is another sign that you are having constipation. Another sign to know that you're having constipation is bloating and abdominal discomfort. Like, your abdomen will be paining you, you'll be feeling pain on your stomach. If you touch your stomach, especially the lower parts, you'll be feeling pain. Is another sign that you are having constipation and you have to manage it. Even though constipation is actually common, if it is left untreated, it can actually lead to some complications like hemorrhoids. Yeah, it can lead to hemorrhoid. In layman's language, hemorrhoids is, I think, is called pile. Yeah, so it can lead to hemorrhoids. It can lead to anal fissure, and it can lead to rectal prolapse. Yeah, so constipation is very 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 bad, I would say. For this constipation not to lead to all these complications, you have to manage it on time. So how do you manage it of constipation? Okay, so the first line of management there is your lifestyle. Like, your lifestyle, how you eat. One, you have to start taking enough fiber, fruits, vegetable, maybe twice in a week, 3 times in a week. Yeah, so take fiber, fruits, vegetable, legumes. Yeah, not just eating carbohydrates, protein. No, just take some fiber. It's good for the body. Then take enough water. At least in a day, take 2 liters of water. Make sure you take water. Is very good for the health. Aside for constipation and all that, water is very good for the health, for the organs in the body, like the kidney. Water is very good for the body. Don't stay dehydrated. I will repeat, don't stay dehydrated. Always take water. Make sure you take water. Management in your lifestyle that can help in constipation is staying active. Like, regular exercise helps improve bowel movement. Yeah, it helps in bowel movement. So maybe after eating, you rest for a while. Maybe takes 10 minutes walk. Just stay active. Sedentary lifestyle is not healthy. I want to advise you points in your lifestyle that can help you to manage constipation is, please don't ignore the urge to defecate. Once you are feeling the urge, you are having that urge to defecate, please try and use the toilet. Like, it's very important. Once you are feeling that urge, try and use the toilet so that you free yourself. You will be free, your body will be free, and you have peace. Please. Can also be used in management of constipation. Medications such as stool softeners, stimulant laxative, barium enema, and suppositories, which may be prescribed by your health physician. So it can help you as well, so that the stool will not be difficult to pass out and you won't feel pain when passing out that stool. Plan for a patient with constipation. So as a nurse, we assess the bowel movements on diet and hydration, mobility, to move around, walk around, prescribed medication, and provide privacy for defecation. The patient Achieve regular and comfortable defecation. Prevention of constipation. Eat enough fiber daily. Take enough water, at least 2 liters of water daily. Then exercise, stay active. And then once you have the urge to defecate, please do use the toilet, please. Remember, constipation is common, but with the right lifestyle and management, you are good to go. So stay healthy. Remember, health is wealth. Okay, no amount of money can afford your health. So if you find this video helpful, don't forget to like, share, subscribe, and follow for more nursing content and health related topics. Bye. See you in my next video.